audífonos. ¿Alguien necesita traducción? ¿Esa funciona? Okay, we're good. And then on Zoom, si necesita traducción, hay un globo, hago un clic y puede cambiar su lenguaje. Okay, and then at the end, we have waters and snacks in the back of the room. We also have some handouts here, and for Zoom, we'll be dropping everything into the chat. Great. Look at these logistics. They're just working right out. Next slide, please. I did that one. Yes, please. Next slide. We are going to jump right in just a moment, but first I want to check in with everyone on the Zoom and in the room. On Zoom, let's use the chat. In the room, we're going to use our hands. How ready, how excited are you to come back to school on Monday? 5 is like, I'm here, I'm definitely ready. 1 is like, oh, I got a lot of questions, I'm nervous, I got to figure it out. Look at the 5s in the room. In the chat, I see some 1s, some 2s, some 3s. We have a mix of feelings. I see 10s in the room. Yay. I think it's important to note that we have different feelings about coming back to school. You can probably tell I'm really excited. I'm almost always at a 10, but we are here today to try to get everyone as close to a 5 as possible, recognizing there are a lot of emotions, a lot of things to consider. And so my personal goal is to make sure everyone feels as safe, as comfortable getting back to campus on Monday. And so how are we going to do that? Our objectives, next slide, please. Thank you. Two big objectives. Whenever you're with the Board District 7 team, we always invite you to build relationships with each other. And that's really important. I'm going to invite my team to stand up in just a minute so you get to meet all of them. But really, we can build relationships so that we can talk. We can understand each other's perspectives, what we're going through, making sure we have the best information possible. And for this meeting, it's about the protocols, the practices, getting back to school, making sure we're set on all of our guidelines. And we're so excited to have community partners on all of the COVID safety.
How do you chat?
Doing together to keep the neighborhood of Wilmington and all of LA Unified as safe as possible. Next slide, please. I want to invite just a couple of norms that we offer often in Board District 7 sessions. We'll do some Q&A later, so we invite you to step up and step back. Make sure you're heard if you have questions in the chat or on index cards for those of you in the room. Again, we're having a lot of different experiences, so embrace both and thinking. Your truth could be your truth, and someone else could be their truth, their experience. We want to respect that we might be in different places as we get ready to reopen our schools. We're not going to have all the answers today. We're going to have as many as possible, but anything we can't answer today, we'll try to follow up with you. So we say, accept or at least consider some non-closure. And then we just invite you to actively, deeply listen to each other so we're building that shared collective vision for safety and excitement about coming back to school. Next slide, please. So with that, we are going to spend our time really starting with a quick introduction of the Board District 7 team. Then we're going to turn it over to our LA Unified Operations team. Then Dr. Franco from our school medical services. Then Dr. Abraham from Kedron Health. Then he's here somewhere, Mr. Rudy Perez from Banning High School. And then we will make sure we have plenty of time for your Q&A. Before we do that, can I just get a wave of hands? If you work at an LA Unified site, can you wave your hands so we can say thank you to all of our LA Unified staff? So many LA Unified staff in the room. Thank you for preparing to come back on Monday. We know it's been a lot of extra, maybe even unpaid work, but we are so grateful for you getting ready for our kiddos and families. Thank you, thank you, thank you. So really quickly, Board District 7 team, stand on up. Next slide, please. We have Marilyn, our Manager of Family and Community Engagement. We have Charnel, our Director of Family and Community Engagement. Emma, our Policy Director. We have somewhere here, Stephanie, our Communications Coordinator, Kimberly, our Operations Coordinator, and my Chief of Staff is coming back from vacation tomorrow, Dr. Dee Watts, but you can see her on the screen there. We are honored and privileged to serve you. You should have our contact information. When you picked it up, we'll also drop it in the slide. But we just started in December, and seriously, it is our pleasure to get to serve the families of Board District 7. So with that, let's jump on into the school operations. I'm going to turn it over to Eric Hansen and Dr. Al Webb from LA Unified to walk us through how are we coming back to school.
All right, thank you. Thank you to everyone, and especially thank you to Board Member Ortiz Franklin. Thank you so much for hosting tonight. All of our staff out there, our parents, hello and welcome. My name is Eric Hansen, proud to be here and proud to serve. As we go through, we have some welcome back. Let's go to the next slide. All right, as we go through, we have our next slide. We have our family guide. So again, welcome back to everyone as we are so excited with school starting on Monday. If you had a chance to pick up our family guide, we have copies of it at the entry here. And if you were at home, all of our families that are at home, we have the link in the chat for our Welcome Back Family Guide. Great information in there.
Tenemos información maravillosa que pueden aprender de.
And preparing all for coming up on Monday with our first day of school. So excited to get our kids back to school. Our next slide. Of course, sending greetings from our superintendent, Megan K. Riley. Very excited about the first day of school, bringing our kids back, our staff. Thank you to all of our staff for all the hard work. Campus looks incredible. Thank you to our principal for hosting today. Thank you so much. And again, living looks wonderful. Excited to get back to school, get our kids back on campus, and get back to learning in person. With our next slide, we have a wonderful video from our...
Welcome back on board.
Welcome back to Friends.
Welcome back to recess!
Welcome back to sports!
Welcome back to class. We're back, we're fully in person, and we have the strongest safety standards in the country.
Welcome back to school!
All right, just an awesome video. Yay! Love that video. Love that. Welcome back to school. Welcome back to recess. So cute. Again, with our preparations for school, again with LA Unified, of course we have full person in-person learning. Really excited about extracurricular activities. I know we've got, again we're banning high school, but of course we've got athletics. Looking forward to all of the competitions that are coming up. I know many sports teams are already practicing. Looking forward to lunch and recess. And of course, I know Dr. Webb will get into a little bit later about all of our safety practices, but as you can see, wearing masks, of course, our enhanced ventilation systems with our MERV 13 filters, and of course, thank you to our parents, thank you to our staff, our kids, for all of the baseline testing. We know that this has been a climb with all of the preparations to get ready for school, with all of the notebooks and the lunch pails and everything else, and adding baseline testing. So thank you for going for baseline testing. We absolutely appreciate it, and have that. And of course, vaccinations upcoming. Our next slide. Okay, with our lessons learned from last year. What we learned, again, thank you to our teachers, thank you to our office staff, food services, principals, administrators, everyone on a school site. Thank you to our parents. What we learned, of course, our kids, is that we can open safely, and we can do it together. So again, thank you so much. Lessons learned from the spring. All right, on this great slide right here, love this slide. Really shows our school teams. It really takes everyone, and everyone has a role to support our kids. You can see on the slide here, everyone taking part. Again, air filters there, food services, classroom instruction, just everyone has a role and a part in helping our kids succeed. Okay, and with our research partners, we're going to hear from our doctors tonight. And but again, just want to remind our community, our school community, that we do rely very much and partner with medical professionals. We have Stanford Medicine, UCLA, and Johns Hopkins. And of course, following our LA County health guidance. So from daily meetings to making sure we are following all of the health guidance to a T. Again, with the safety, I know Dr. Webb, I almost steal your thunder. I know you're going to be getting into the safety practices there, but want our families to know that we are in tune and really adhering to all of our LA County health guidance and procedures. Dr. Webb.
Thank you so much, Mr. Hanson. I definitely appreciate it. My name is Alfonso Webb. I'm Senior Director for the Office of School Culture, Climate, and Safety. And it's a pleasure to be here with you tonight. It's a pleasure to see those faces here. And for those of you online, welcome. And I want to go through a few of the items that you can expect to see or your children can expect to see when they return. I want to reiterate that our top priority is ensuring that we have a safe learning environment for all of our students. So to ensure we have a smooth reopening for a full in-person return on this Monday, the 16th, it's imperative that our focus remains on ensuring that we have this safe environment in place. To accomplish this, we lean on the guidance from some of our professionals with regards to our local, within in-house, our medical doctor, as well as our partners throughout the county, as well as our local, state, and federal agencies. A major part of this work involves implementing these particular strategies in innovative ways, which means that you'll see that we are creative in how we make sure that we meet all of those particular standards and protocols that are set by those local, which would be the LA County Department of Public Health, the state, which is California Department of Public Health, or Cal OSHA, as well as the CDC. So within the safety efforts, you'll see that face masks will be required on campus, indoors and outdoors. I know that the outdoors portion of this mandate is a district policy just to ensure that each of our students and staff are safe, either whether they're outside playing on the gym apparatus or if they're playing basketball or whatever. We want to ensure that all of our students are safe students and staff are safe while they're on campus. Another enhancement will be the the ventilation, which helps to clean the air and makes it purifies the air. So we have, on top of the MERV 13 filters that we also have the air scrubbers that actually are in each of those classrooms. On top of that, we have the COVID-19 testing and vaccination. So these are critical areas that we see that help to make it a safer environment for your students and our staff. Next slide, please. Part of this effort means that we have to look at ways that we go over and beyond to make it easier for our staff and our students to obtain their baseline testing. Each student and staff is expected to have this baseline test prior to coming in on Monday. Now, we understand that some people have waited a little while, and so the lines may be a little bit longer, but we still expect for our students and staff to have that baseline test before they return for Monday's start of school. What we have done is extended our testing availability, and on this screen you'll see that the hours are posted. We have extended hours on Wednesdays as well as on Saturdays, so you'll see that we have additional time, but it's imperative that they get these tests have a negative COVID test prior to coming in on Monday. Now, what it will look like when your child returns in school. So you'll see that some of the signage, as well as the drinking fountains are now cleared to be open. Our maintenance and operations teams are going across the district throughout each school, flushing out the water so that everything is fresh and clean for students. Also, you'll see the hand sanitizing stations placed strategically throughout campus. You'll find that kids will be physically distanced. There's no more of a specific distance that's required, but we are establishing our systems, we are establishing our floor plans within each of our classrooms to maximize the distance for our students. Additionally, we will remove some of the signage that's on there in terms of the specific distance frames, because you know that that's one of the areas that we'll also make sure that kids are maximizing their distance. Now, one of the things that you understand, our kids have been out for a year and a half. For those 18 months, it's been a little difficult. We understand that that's not the optimal environment, but we want to make sure that we provide more opportunities for students. We understand that kids may have missed out on some of their learning. So what we'll have is additional teachers on hand for math and reading. We have more one-to-one tutoring and small group instruction for students. So this is one of the ways that we'll look at making sure that our students are ready, as well as updated technology that they'll be able to utilize. On top of that, we understand that sometimes you'll find that during COVID-19, some of the kids may have watched a lot of TV to found out about COVID, and they may be afraid of things. So we do have wellness support that's available for each of those students as well. So within that development, we have additional counselors that will be on site for mental health support. We also have more staff to connect with families, because we understand how sometimes things can be difficult. You get a little cabin fever when you're inside all the time. So now we're glad to have everyone back. We understand that the optimal learning environment is back in school. We have safety measures in place, and we're looking forward to our kids coming back. Now back over to Eric.
All right, thank you, Dr. Webb. Okay, on this slide, I'd like to share a little bit about the change from last year to this year. So last year we had distance learning, and Senate Bill 98 sunsetted at the end of June, and that sunsetted distance learning. This year, we have independent study with AB 130. So there's a difference there, what it looks like from last year to this year. So we have two options for school. Of course, in-person learning, and the other option is independent study, which again is different from last year with distance learning. So we'll go to the next slide so I can share a little bit about what is independent study, what does that look like? So again, two options, in-person and online independent study. So our online independent study program is run through our City of Angels School. What this looks like is for our elementary students having 3 hours a day of daily live instruction with the teacher, and when they're not with their teacher, they'll be doing their own independent work. For our secondary students, again, it is daily live instruction for our secondary students, 3 70-minute periods per day, and when they are not with their teacher, it'll be independent work. Some of the questions from our parents that we've had about online program, again, this is run through our City of Angels School. So one of the questions from parents was, would I have my same teacher? And it is probably not likely that you would have your same teacher, because your teacher would more than likely be at your home school. So more than likely would not have your homeroom teacher at your school site, where your neighborhood school where your child goes to school. So again, this is through City of Angels in Los Angeles Unified, and you would have another teacher from, again, City of Angels. So again, as parents, if they are interested in this, we asked our parents to go ahead and submit their interest. This week, there was also a Blackboard Connect message that went out to parents that had submitted interest. So parents, if you, again at home also, if you did submit interest last week, you would have gotten a Blackboard Connect message. Please look at that message. It would have been an email. And we do need you to confirm, because what our schools have discovered is that parents that had submitted an interest for online, schools contacted them just to be sure that that is what parents wanted. And we discovered for some parents, they said, oh, that was a mistake. I want to be in person. So the schools then made those corrections in our system. So again, parents, if you did submit a request for online independent study, there was a message that went out just asking you to confirm that that is the program that you choose. And with that, we'll go to the next slide. And there we go. See you soon. Looking forward to Monday. Thank you.
Webb and Mr. Hansen. Let's give them a quick round of applause. Get some energy going in our bodies. In the chat, I do want to remind folks in the room, if you have questions, to put them on the index cards. We're collecting them and we'll ask a few at the end. Several have come in operations-wise, so I'll flag for the team if you want to put in the chat or think out loud about testing results. And if they haven't come through yet, how do they do that? Who do they call or contact? But now we're excited to hear from one of our school doctors, because we know that hearing from the professional experts can really help us feel confident coming back to campus. So Dr. Franco, take it away.
Hello, everybody. Good afternoon. Buenas tardes todos. We can go ahead and go to the next slide. So my name is Rosina Franco, Dr. Rosina Franco. I am the LAUSD Senior Physician for Student Medical Services. I'm a board-certified family physician, so I treat people of all ages. And I also completed a fellowship in adolescent medicine. Next slide. So first I want to start by telling you a little bit about my story, which I don't think is really a unique one, especially in our communities. I am a daughter of Mexican immigrants, one of 9 siblings. My parents came to the United States looking for better opportunities for the family, for a better education for their children, and to work hard. I am a prior LAUSD student as well. Next slide. So I've trained in family medicine and also in adolescent medicine in Los Angeles in the Boyle Heights community at actually the White Memorial Medical Center Family Medicine Residency Program. And as a Latina growing up in this community, I'm very much committed to high quality health care within our underserved communities. And I've done that and I've worked in our communities because of that commitment in Los Angeles now for over 20 years, 14 of those working as a physician for LA Unified School District. Next slide. So I am going to talk to you about the public health recommendations that we've implemented into our schools, but first, next slide. I want to talk about vaccination, because vaccination is the most important thing that we can all do to protect ourselves, to protect our loved ones, to protect our communities. Next slide. So why are vaccinations so important to me, aside from me being a doctor? I think one of the things that probably led me to go into medicine is the story that my mother told me over and over again as I was growing up. I'm a little distracted because my cousin's here and she knows this story and she's heard it over and over again with me. She's a LA Unified teacher and her daughter a student that graduated from LA Unified. But anyway, my mother grew up on a ranch in Mexico. And when she was a young woman, traveling nurses came to her home to vaccinate the family, to vaccinate anybody they could find against smallpox. And the nurses were able to vaccinate everybody that was in the house. But at the time, she had 5 brothers who were out in the fields, working out in the fields. And they weren't allowed to stop working to come in and get vaccinated. So unfortunately, shortly after that, the brothers who were not vaccinated became very ill with smallpox. And my mom and her sisters, who stayed healthy, were able to take care of them. But unfortunately, very unfortunately, one of her brothers died because of smallpox. Next slide. I think I told the whole story already, so next slide. So I want to talk about the efforts that we've done here at LAUSD regarding COVID vaccination. And I'm proud to say that I was very much involved with all of these efforts. Back in February, LAUSD started an employee vaccination program. We were able to provide over 37,000 vaccinations from February, about mid-February till about early May at a megapod site and 7 stationary school sites. In the spring, we were also able to launch a vaccination program for students because vaccinations were then authorized for children 12 years of age and over. And these were mobile vaccine programs. These mobile teams went to 160 different middle schools and high schools to provide vaccines to the students. They also ended up providing vaccines to the adults that brought them in. At the same time, we've been partnering with community agencies who have been coming onto our campuses to provide vaccines at over 30 schools. And some of those partners, and one of them is here right now, continue to provide vaccines to our children on our campuses. Everything's free, by the way, everything free. In the fall, a lot of people don't know this, but the school district does have and has had free clinics that the school district runs where we provide vaccines. We provide other services too, but vaccines is a major service that we provide. 14 of those clinics will be providing COVID vaccine for free to our students as well. Next slide. So the first thing I want to say is that vaccines work. We know this. For decades, we've been vaccinating our children, and we know that they work. And polio is a great example, right? So in 1952, the United States had a peak in polio cases, over 35,000. 21,000 people became paralyzed because of this infection, and over 3,000 people died. Compare that to the numbers now that we talk about COVID, right? COVID cases are much higher, COVID deaths are much higher. Yet we vaccinated and vaccinated and vaccinated. And by the early 1970s, polio was considered eradicated in the United States. Now, a lot of you are probably younger than me, and you don't remember having classmates that have been paralyzed by polio. I remember it, and I don't want to ever see that again. And that is why we continue to vaccinate, so that we don't ever see anybody else become paralyzed because of this virus when it's completely preventable. Next slide. So one of the questions that we get a lot is, or one of the fears that we get a lot is people think that the mRNA vaccine, the vaccine that we've been giving in the schools, which Pfizer and Moderna, was put out too fast, right? There weren't enough studies, there were shortcuts. I'm here to tell you that there were not shortcuts, okay? Now, the emergency use authorization, this illustration is really great. I really love it because it shows you what happens when you have a regular FDA approval. You still have to go through 3 stages of studies, okay? Once you do that, you review all of the studies. The FDA approves. After they approve it, they produce the medication, and then they distribute it. But with emergency use authorization, what we do is we do the studies, the 3 stages. You see up there that they were exact same studies, exact same stages, at the same time that you're mass producing the vaccine. And the reason for that is because we're banking on the fact that the vaccine, or the hope, that the vaccine will work, will be safe, and it will work. And this was actually not a big gamble for us because a lot of people don't know, but mRNA is not new technology. We've had it for over 10 years. We've been using it to treat cancer. And actually, right before COVID-19 came around, scientists were already trying to develop a coronavirus vaccine that also other coronavirus types of coronavirus vaccines can cause the common cold. So they were already trying to produce a vaccine against coronavirus. But then COVID-19 came around and everybody pivoted, and they developed the vaccine against COVID-19. So as soon as those studies were done and they saw that the results were very good, they were able to approve it, and as soon as it was approved, they were able to distribute it. So for all of those reasons, that is why the vaccine came out so fast. Next slide. So how does the vaccine work? I'm not going to give you a whole biology lesson today, although I really love to because I love to teach. But I want to say that the vaccine does not have any component of the virus at all. What it does is it has mRNA, which is genetic material that teaches your body to make a protein. So what it's doing is it's making one protein that's in the virus, which is the spike protein, so that when it comes into your body and it makes that protein, your body says, hey, this doesn't belong here. So it starts to attack it. It starts to make antibodies. It starts to activate your immune system. But since, it's just a tiny little bit, it's not that bad. Some people do have symptoms, not everybody does. It doesn't mean it's not working. It works. So that next time when you actually get exposed to the virus, the real virus, your body already recognizes it and boom, quickly, it produces those antibodies, it activates those immune cells, and it kills the virus before you can ever get sick. So next slide. And this is just an example. A lot of people are talking about the Delta variant and well, what's the point of the vaccine if you can still get infected? Well, first of all, I want to say that there's a less than 1% chance of you getting infected if you're vaccinated, okay, if appropriately. That means 2 vaccines, right? But if you do get sick, because nothing's 100%, the chances of you getting very sick are also extremely, extremely low. So here's just an example of a chest x-ray of somebody who had vaccination and got infected versus somebody who did not have vaccination and got infected. Next slide. The other thing I just want to mention really, really quickly is that there are a lot of reports that are being published, and the most recent one I saw was by the Kaiser Family Foundation on July 30th, just very recently, and they also did report that breakthrough cases in all the states that report their cases, that means that by breakthrough cases, I mean the people who were vaccinated who got infected with COVID was less than 1%. And the people who were actually hospitalized because they got infected with COVID after being vaccinated was almost 0% in California. Next slide. So we're vaccinating in the schools, right? We're promoting vaccination in the schools. That is the most important thing you can do. What's the next most important thing you can do is mask, okay? Masks work, and there are studies that prove it. And if you want to talk to me about the studies afterwards, we can do that. We don't have that much time right now, but next slide. The CDC recommends masking in K through 12 schools, right? They're recommending masking in the indoor setting, but in our district, of course, we're recommending masking indoor and outdoor, and that is because we work very closely along with the Department of Public Health in LA County, and that is what they also recommended to us. So next slide. So again, masks do work, but they don't work if we don't use them, right? So we all have to wear our masks, whether you're sick or not sick, whether you're vaccinated or not vaccinated right now, we all have to wear masks because this Delta variant is way more infectious than the previous one, right? So we all want to protect ourselves, we all want to protect our loved ones, we all want to protect our community, so we all need to wear masks. Next slide. And then there are a lot of myths that are out there about masks, about, oh, well, you can't breathe if you wear a mask. Well, if you're wearing an appropriate mask, like a surgical mask like I'm wearing, or if you're wearing a cloth mask, then you should be able to breathe just fine. You shouldn't be wearing like a vinyl mask or a plastic mask, etc. They do not block oxygen. And children ages 2 and over can safely wear masks for extended periods of time, for hours. There have been studies on this, and it's safe and it's effective. Next slide. And also, some people say, well, it traps carbon dioxide. It does not trap carbon dioxide. Carbon dioxide particles are very, very tiny. They're smaller than the respiratory droplets. And if respiratory droplets can get out of your mask, so can carbon dioxide. So you don't have carbon dioxide collecting underneath your mask. Again, you want to make sure you're wearing a mask that's made of breathable material. And just remember that our anesthesiologists and surgeons spend hours and hours and hours wearing surgical masks, and it's safe. Okay, next slide. So but now if you wear a mask, you have to wear it the right way, right? How many times do we see people with their mask underneath their nose or underneath their chin? It doesn't work that way, or gaping holes on the sides. No, you have to have it tight over your nose, snug under your chin, and snug around your face, because it really just needs to minimize the amount of droplets that leave or come in. Again, I think I already mentioned so the way that you get it to fit snugly is you make sure that you have ear loops that are not too loose, or you tie it behind your back. Next slide. And also testing, which our partners out here have already spoken about. We're doing a lot of testing, so I won't talk too much about that. Next slide. Again, a lot of this was already spoken about. We do have a community engagement team that will be contacting our students, families, staff, if anybody comes up positive, and they will be contacting anybody who's been a close contact. And as well, we will continue to work with the Department of Public Health to update our protocols as necessary. Next slide. And why is testing important? Because it saves lives. If we test somebody, we find that they're positive, and we isolate them, then we prevent that person from transmitting the infection to somebody else. That's going to save lives. It's going to help us open our schools, and us providing it for our schools is providing it to our community, who doesn't always have as many resources as more affluent communities. So I think we're providing a really great service to our communities. Next slide. So just reminders, everybody stay safe. Number 1, get vaccinated. Number 2, wear your mask. Number 3, get tested. And then we all, as you know, are doing the daily pass before we come into campuses. And physical distancing is something that we're going to recommend as per the Department of Public Health and as per their guidance changes. So thank you very much, everybody.
All right. Thank you, Dr. Frank. Thank you. And I heard a little bit of our students and families' stories in your story too, so thank you for sharing that. And I want to again remind us to talk to one another, help share the information with each other so we feel as safe as possible. So you heard a little bit about our school operations, our school doctor, our medicine, and our practices. But let's get some validation from the community, but also some connection. And I just heard, team, tell me if I'm right, we got 2 people to get vaccinated right here, right now with Kedron Health. Thank you, Kedron. Just in the last few minutes. They're so excited back there. Thank you. So, Dr. Abraham, share with us a little bit about our community resources.
Yes, absolutely. Thank you so much for having me. My name is Dr. Jerry Abraham. I'm the director of Kedron Vaccines in South Los Angeles, and we're proud to report that we have vaccinated over 300,000 people in our community, and we're just that much safer, that much closer to ending this pandemic. Thank you. Yay, and I want to give a shout out to our vaccine team in the back and to those that got vaccinated today. Round of applause again. And to everyone that is vaccinated in the room, another round of applause. Thank you for playing your part. When we all do our part, when we're all responsible and accountable to one another, the quicker we can end this pandemic. Go ahead and next slide. All right, go ahead. So really some of the main messages I want you to hear from today are that vaccines are free, safe, and effective. In fact, they're the most important and effective tool at ending this pandemic and keeping our communities safe. Go ahead, next slide. So as you know, we're seeing an uptick in cases throughout the county, and it is very concerning, about 40% up from 2 weeks ago, and that is because of the Delta variant that's now the dominant strain within our community, and it is spreading while symptoms may be mild, especially for those that are vaccinated, asymptomatic, or mild cough and cold symptoms. This still is a real infectious disease that is spreading, specifically amongst unvaccinated people that are getting hospitalized, and there are people still dying from this. So really, there's not a moment to lose, not a drop to waste. Let's do everything we can to end this pandemic, including getting vaccinated. Next slide. So getting vaccinated is such an important part of the layering system that, as an outsider, I don't work for LAUSD. I'm not paid to be here, but we do this because that's what we do in medicine. We help our patients, we care for our community, and we want to also applaud everything the school district, what the board member has mentioned, including Dr. Franco and all of the others here. This layering system is really our best defense. We've talked about the layering of masks, the social distancing that will follow based on guidelines. We've talked about testing and its role and strategy. We've talked about the air quality, air purification systems, and of course we've also talked about vaccines. So when we do all of those things, even for those that are under 12 that are not eligible for vaccines, they will be protected. One of the most important things we can do, though, are those that are eligible, everyone over 12 years old, to please get vaccinated. I'm not going to cover a lot of the material Dr. Franco mentioned because that's actually at the heart of it. A lot of the data is there. We followed the rigorous steps. These vaccines are safe, effective, and free, and I really want people to hear that. Next. I do want y'all to know that equity is at the heart of what we're doing with this vaccine program, and that's very important. These vaccines are for everyone. They're not just for people in Beverly Hills or Malibu or different zip codes. They're for people from my community in South LA, Black and Brown LA, where these vaccines are not an experiment. We understand that in our community, in Black LA, for example, people are reminded of the Tuskegee trials, the abuse of Henrietta Lacks cells, undertreatment of Black pain, the medicalization of racism. These are not that. This is not an experiment. These are life-saving essential medicines, and we don't want anyone to hesitate or wait. So what we do at Kedron is we really take the time to engage you, to educate you, and we hope that you'll roll up your sleeves and take that shot. And then, just as important, we hope we activate you so that you can get your household, your coworkers, your colleagues, your classmates, your church members, and everyone in our community vaccinated. So we really hope that we empower you with information so that we can dispel the myths and the misinformation that is out there that's very much so at the heart of this pandemic. We just want this to be over so that we can get on with our lives, especially getting back to school, back to work, and back to loving our loved ones. Next. And we've kind of talked briefly about what COVID-19 is. It is a virus that is very similar to the cough and cold virus. However, it does spread a lot more, and there is increased fatalities and severity. And so that's really why this pandemic has been going on. And we didn't have these tools before December. They were emergency use authorized in December of 2020, and now our job is to roll these out as quickly as we can. As you know, COVID-19 is transmitted in the community, as have already been mentioned, through talking, coughing, singing, all of the ways that we interact with one another. We want to make sure that we're continuing social distancing and continuing with all of our air quality, and we'll continue with all of the cleaning, as you heard earlier today. Next. And every vaccine is a little different, as you know, as was already mentioned by Dr. Franco. The 12 and older population, our middle schoolers and high schoolers, are eligible for Pfizer, which is mRNA technology, and Johnson & Johnson is a more traditional vaccine technology like the flu shot that we give every year, an adenovirus viral vector vaccine. And so every vaccine is absolutely effective at preventing death and serious illness. So just know, while there's always, okay, which vaccine do I get? Pfizer, Moderna, Johnson & Johnson, which is right for me? Ultimately, at the end of the day, all vaccines are effective. For the students, for the middle schoolers, high schoolers, you'll be offered Pfizer. We're expecting Moderna at some point to be emergency use authorized for younger ages. We know there are clinical trials looking at 5-year-olds to 11-year-olds where elementary school students may be eligible as early as late September or October. So we'll do everything we can to roll out those vaccines because we do know we want everyone protected, even those under 12. Next. Not going to go into the details of Pfizer, Moderna, and Johnson & Johnson, so we can go to the next slide. So just so you know, in case you haven't been vaccinated yet, there's pain sometimes at the site. That's the most common side effect, sometimes some swelling. Otherwise, some people feel a little under the weather, some tiredness, mild fevers or chills. It usually goes away in a day or two. Again, we have vaccinated over 300,000 people at Kedron, and we have not sent anyone to the hospital. We haven't used an EpiPen. Hundreds of millions of doses have been administered here in the United States. Again, a very few adverse events, most commonly due to food and medication allergies. Around the world, over 4.8 billion doses administered now globally. So again, one of our most effective and safe and thankfully free treatments that are, or preventions that are available out there to us. Next. And so we've already kind of gone over why vaccines are safe. They have gone through a robust testing process. Next. We anticipate the FDA to provide full approval within the next few days, if not weeks. And will we need a booster? Where do we go from here? We're going to watch the science closely. There's a good chance that those with immunocompromised or underlying medical conditions may get a third shot. People over 65 who may have waning, declining immunity, effectiveness, protection, they may need a third shot booster. And again, we're watching to see what happens this fall. We'll continue to monitor the variants, but ultimately we want to get back to what we're doing. So as people think about going back to school, first and foremost, I want you to know vaccines are safe, free, and effective. And number two, we are doing all the right things to open up our schools safely. We know a lot more now about COVID-19 than we ever did, which is why we're able to do the things that we're doing, opening up our economy, opening up our schools, getting back to our lives. So with all of that, thank you so much. If you have any questions, we'll be around. Cheers.
Thank you, Dr. Abraham. And it is really great, especially for all of our students on the call and in the room. If you are interested in studying science, look how many great opportunities there are in the professions. Who knew we were going to get such a lesson on the medicine and the science of COVID? But I think it's really important to help calm some of the fears around why it feels safe to reopen. We're getting a lot of questions here in the chat. And I will tell you, I feel really confident because of all of the layered protections we're hearing about, but also because of our phenomenal LAUSD staff that have been doing so much planning. And so I know there are a lot of schools represented here in the room, so I'll invite you to shout out your school in the room or in the chat. Tell us where you go to school and who you're excited to see. We're going to hear from one of our school leaders about their preparation to come back, not just the physical safety, but some of the emotional support that we know is also going to be a part of returning to campus. So Mr. Rudy Mendoza from Banning High School right here.
Thank you, Board Member Franklin, and welcome everyone. I'm Rudy Mendoza. I'm the proud principal of Banning High School and also a proud alumni and a proud community member. I just want to take a few moments here to talk about what social emotional support we're planning to provide our students as we prepare and we are returning back to campus. As you know, last semester, we did have advisory period embedded in our bell schedule. And in June, when we knew that we had to prepare for a physical return back to campus, our teachers met and decided that we would begin with advisories, and our governance approved it because we understood how important it is to build that personalization with our students, especially because we haven't seen our students in 3 semesters. And so we wanted to make sure we had that personal connection from day one when they come back to campus. And so we wanted to make sure that we had an avenue in which we were able to check in with our students, check the pulse of the day, and any individual students that may appear to be maybe experiencing some levels of anxiety or anything else, and we can direct them and provide that additional support that they need so that they can navigate themselves successfully throughout the day. We also have a pupil social worker, which we call our PSW, that through school-wide preventative campaigns, we can bring awareness about the types of support that are available to our students. Our PSA also is the leader and facilitates our crisis team, which is comprised of counselors, our PSA, our PSW, and some teachers in response to, as you know, being from the Wilmington community, I feel comfortable talking about this. We have such a wonderful, great community, but sometimes it'll pop off in the wrong direction, and some of our students are either exposed to it or directly involved in it or know someone that has. And so some of the community events that take place, our students come to school and they need additional support, or maybe any traumas that might be affecting our students. But we especially want to recognize and share with our students that we understand and acknowledge that returning from a pandemic, that our students are going to need that additional support. And it's okay to talk about it, and it's okay to ask for it. In addition, we have a brand new well-being center, thanks to the LA County, that we will be working very closely with in partnership to coordinate those services that our students will need. And they can walk in at any time, okay, and ask for those services or just to talk to someone. So we are very blessed to be able to have those services available through our new well-being center as well, which is just an additional layer of support for our students. We have an excellent support team. We have a large student support team to address the barriers preventing our students that may not attend school on a daily basis. They're having challenges and even just getting up in the morning and coming to school. And this is something that we definitely are taking very seriously because we want our students here every day. We want our students to feel supported and feel safe. But we also recognize that coming back from a pandemic, we may be addressing some issues that are very deep-rooted, and we want to make sure that we are ready for our students and providing them the supports that they need to get back on track, and also providing an array of attendance incentives for our students to get back on track. Again, working with our students, understanding that they're transitioning to physically returning back to school We want them to feel safe. We want them to feel confident as they're navigating themselves through the school day, but especially through the school year. We have a very strong community support system here at Banning High School. We have a wonderful community, as I mentioned before, and we really focus on implementing school-wide positive behavior here at Banning High School. Not just teacher to student, it's student to student, and we encourage that on a daily basis. And we want to make sure that we provide those interventions of support to our students, and so that way we are constantly campaigning for a safer campus and a more nurturing environment so that students can focus on learning. And so we also purchased for this school year an additional counselor. We're looking at hopefully maybe adding another counselor so that we can reduce the caseloads of our students. I am proud to say when I'm looking at the dashboard that we have programmed approximately over 2,700 students that are returning back to Banning High School. We're hoping that all of them return. We have students that are coming, are returning back from other schools that they may have checked out to. They're returning back to Banning, and we're so excited about welcoming everyone back, our community kids back to our school. So we're very, very excited about that. We also have a full-time PSA counselor, again, who supports our students who need that extra help because they're experiencing barriers that may be preventing them from coming to school every day. And then we also have a full-time nurse. And so we're very fortunate to have that as well. I want to talk about some of our partners that we have, and one in particular, which is A Needy Wilmington, which is a nonprofit organization that has birthed here at Banning High School to support our homeless, our newcomers, and other students to provide them with basic necessities, such as toiletry items, school supplies, clothing, and even covering senior expenses. We know that our students come with those hardships. But we really believe here at Banning, especially personally myself, that money should not get in the way of any of our students participating in anything. We are proud to say that the founder is a Banning teacher, and is a long time Wilmington resident. So we are very proud as we teach our students here at Banning to give back to the community, never forget where they come from, and together we build that family environment experience for our students, because here in Wilmington we really stand by each other. We may not have much, right, growing up in Wilmington myself, but we will give the shirt off our back to those and to our neighbors, and you know that is true all the way through and through. And so that is the philosophy here at Banning, empowering our students and knowing that their voice is important. I always tell my students that their voice is the most important thing on this campus, and that asking for help is not a sign of weakness, it is a sign of strength. And if they can learn that now, they can take that through their entire life and be successful. And so we are excited about welcoming our students back on campus. We have done everything possible in ensuring that everywhere our students turn, that there's a sanitizing machine there for them to use. There's masks in the classrooms, sanitizing wipes, everything that they possibly need to lower that level of anxiety. There's a support system here at Banning that is one that is ready to jump in and help our students on day one as soon as they hit the front door there. But I just want to say that we are ready to welcome back your children. We're excited about seeing them again. The teachers met today. We did a professional development on how we can build a sense of community in the classroom and giving them the teachers the instructional strategies they need and can use day one. So we are excited again. Welcome back, families of Wilmington. We are excited about seeing your children on Monday, August 6th. And remember that school begins at 8:30 this year. Not at 8, but at 8:30. And we're going to go ahead and continue that, as I know that in the school year 22-23, that it will be a mandate that all secondary schools begin at 8:30. We started this year. So thank you, everyone, and thank you, Board Member Franco, for the opportunity. Thank you so much.
And thank you for hosting us, Mr. Mendoza. We have a couple minutes. We're going to do some rapid fire questions and then a couple of longer ones. So rapid fire, principals in the room. Should students bring their Chromebooks on Monday? Say it really loud and proud. Yes, students, bring your Chromebooks or iPads to campus on Monday. For everyone, how often are we being tested in LA Unified? How often? Weekly. Where can parents see the results of their COVID tests? What's the platform called? Parent Portal. This is the pop quiz, real fast. What's the health screening tool we use? Where do we go for the daily health questions? Daily Pass. Feel free to capture it all in the chat. Okay, a serious one. What happens if someone tests positive or if they show symptoms? School team, exactly what happens? Please walk us through.
Okay, so I'll take that. When we have a community engagement team that is working really hard every day, the first thing they do in the morning is they look at all of the test results from the day before, and anybody that comes up positive gets contacted and they're asked to isolate, and anybody that they identify as being a close contact is asked to quarantine. So the isolation period is for 10 days. The quarantine period is also for 10 days. There is a stipulation for vaccinated people that if they test on day 5, they can come back on day 8 if the test is negative. So they also communicate with the principal, and there's a team at every school that helps the community engagement team identify students or employees who may have come up positive and any close contacts so that everybody can either isolate or quarantine and stay safe. I hope that answered the question.
I guess another question that comes up for this is, how will others be notified if they were in close contact or someone in their class tested positive or had symptoms? Families want to know, what's the notification process?
So Dr. Franklin, let me add on to that. And so with that, let's use a second grade class as an example. So if a student contacted COVID, of course, as Dr. Franco already shared, they would go into isolation, and the community engagement team would notify the students that are a close contact. That is how we would know. That was how our families would know. Would we let them know the name of the student? No, of course not, because that would be private information. Would we let the second grade class next door know? No, because they are not close contacts. Again, it goes back to identifying and making sure that the family of the student with COVID or any close contacts are notified. Hopefully that added on to Dr. Franco.
Yeah, and I think the way that they're notified is via phone, email, whatever contact information is in the patient's chart, basically, because that information goes along with the test. But also the school has emergency contact information as well.
Additionally, we have a dashboard that's set up for each school that will reopen next week when school reopens, and parents will be able to go in and log in and see what grade levels may be impacted by a positive case or not. So that will be available next week. We expect to continue to have this available for all of our parents.
And we'll just take a couple more minutes if you all can stay with us, but I understand it is 5:30. Things have changed about physical distancing, cleaning, temperature checks. What's different now about those things that we can specify, especially physical distancing, cleaning, and temperature checks? What should we expect?
Thank you so much for asking that question. As I alluded to earlier, the classroom environment will be established in a way that maximizes the physical distancing in the classroom. There's no specific minimum requirements, just as if you go into a restaurant, there's no specific requirements for you to sit next to someone or whatever the case may be. So the same approach is taking place in the classroom. However, we do have additional measures in place with wearing masks while on campus, while also maintaining the COVID-19 COVID-19 testing and vaccinations for those that are eligible or that want it. We have all these measures in place to ensure that we have a safe environment in addition to the MERV 13 filters that are inside of each of our classrooms.
And also adding on to that, Dr. Webb, the full cleaning and making sure we're using lots of static cleaners every day in classrooms, also cleaning play equipment, so all the daily cleaning measures that are in place.
I just want to say one more thing also, that the district does have additional personnel to supervise students to make sure they're wearing their masks appropriately, that when they're eating and not wearing their masks, that they're spaced out appropriately. So there is going to be more supervision.
I think has come up, and maybe for a community doctor too, if we're eating with others, are we likely to catch it, particularly children?
Great question. Some of the things about social distancing that we just mentioned, because we've learned so much about how COVID-19 has spread since the pandemic started, we have seen that the transmission between children is less than the adult population. So it's very important to know and hear. And so it's not that we're saying no social distancing arbitrarily. We're saying it because transmission is lower, and especially in schools. And there are studies that support that. And so, doing what we can appropriately and responsibly is sufficient, but we're not, just saying no social distancing for no reason. It really is because children transmit it less. And one of the reasons is because COVID-19 affects something called the ACE receptor in the body, and children just have less of those. And so that's a reason why adult-to-adult transmission is actually higher than between children. So actually going to school and getting COVID and going home and giving it to adults is less likely than the chance that children are actually being exposed to adults with COVID-19. And that's really what we also want to be mindful of when we're out in the community, in home, going to all the other things that we'll be doing outside of school.
For that. And I know there are still lots of questions in just a couple days before school opens. I want to go to the next slide and invite folks to get your questions answered from our staff at LA Unified. We have lots of contact phone numbers for your specific situation. And we also will be sending out newsletters. We're posting on social media. So we want to make sure we're staying in constant communication, doing our very best. Our team will try to compile more answers to any questions that weren't answered, and you'll get lots of frequently asked questions and answered on the LAUSD website, which we will send out. If you don't receive our text messages or emails, please sign up for our newsletters. We're putting the information in the chat, and we'll also make sure it's displayed here. We have a couple of upcoming sessions we hope to invite you all to talk about policy and other things related to our growing and enhancing school system. Those are on the screen, but we'll talk more about those later. I'm just going to put our contact information for you all. Everyone here in person, please come talk to us. Come talk to the doctors. Everyone online will be following up with you via email and social media. Thank you, thank you. This is a very personal decision for every student, every family, but we at LA Unified are so ready and excited to welcome as many students and families back to campus as possible. We are ready when you are ready. Thank you, everyone. We hope to see you on Monday. Have a great evening. If you want vaccines.